Perampanel is a medication used to treat specific types of seizures, including focal and generalized tonic-clonic seizures. It is classified as an anticonvulsant. It is taken orally, usually once a day, with or without food. It is important to take it at the same time each day. The dosage is based on your medical condition and response to treatment. It is important to follow your doctor's instructions carefully. Before taking Fycompa, it's important to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, be sure to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily at bedtime. If you are using the liquid form, shake the bottle well before each dose and carefully measure it using a special measuring device/spoon. The dosage will depend on your medical condition, response to treatment, and other medications you may be taking. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. It's important to use this medication regularly to get the most benefit from it, so try to take it at the same time each day. Do not stop taking Fycompa without consulting your doctor, as some conditions may become worse if the drug is suddenly stopped. Keep in mind that, while this medication helps many people, it may sometimes cause addiction, especially if you have a substance use disorder. Take Fycompa exactly as prescribed to lower the risk of addiction. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of Fycompa include dizziness, trouble walking, nausea, and headache. However, these effects may lessen over time. Remember, your doctor has prescribed this medication because they believe the benefit to you is greater than the risk of side effects. Serious side effects are rare, but if you experience blurred vision, frequent falls, or any unusual changes in your mood or behavior, contact your doctor immediately. It's important to seek medical help right away if you notice symptoms of a serious allergic reaction, such as fever, rash, or trouble breathing. Be sure to discuss any other potential side effects with your doctor or pharmacist. As for the daily dosage and optimal timing for taking Fycompa, follow your doctor's instructions carefully to ensure the best results for your condition. If you or your family notice any unusual behavior changes or other mental/mood changes while taking Fycompa, such as aggression, impulsive actions, anxiety, irritability, paranoia, hallucinations, or thoughts of harming others, it is important to tell your doctor right away. These symptoms may occur when you first start taking Fycompa or when the dose is changed, and they may even occur after stopping the medication. It is important to avoid drinking alcohol while taking Fycompa, as it may make these symptoms worse. Be cautious and vigilant for these symptoms, and seek medical attention if you notice any concerning changes. The daily dosage and the optimal timing of Fycompa should be determined by your doctor, based on your individual condition and needs. Before taking Fycompa, make sure to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Be sure to also inform your doctor or pharmacist about your medical history, especially if you have liver or kidney problems, mental/mood disorders, or a history of substance use disorder. Fycompa may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana as they can increase these effects. Do not drive or use machinery until you can do so safely. Before undergoing surgery, inform your doctor or dentist about all the medications you are taking. Older adults may be more sensitive to the side effects of Fycompa, so use with caution. If you are pregnant, discuss with your doctor the benefits and risks of using Fycompa. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Fycompa, as they can change how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription/non-prescription drugs and herbal products. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Fycompa is orlistat. Additionally, other medications can affect the removal of Perampanel from your body, which may impact how Fycompa works. Examples include rifamycins, such as rifabutin, St. John's wort, among others. It's also important to note that Fycompa may decrease the effectiveness of levonorgestrel-containing birth control, potentially leading to pregnancy. Discuss with your doctor or pharmacist if you should use reliable non-hormonal backup birth control methods while using Fycompa and for a month after you stop using it. Additionally, be sure to inform your doctor if you experience any new spotting or breakthrough bleeding. If you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, or opioid pain relievers, it's important to inform your doctor or pharmacist. Check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Ask your pharmacist about using these products safely. Remember to always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much Fycompa and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include changes in mental, mood, or behavior, such as agitation or aggressive behavior. It's important to seek help right away if you suspect an overdose. This medication should not be shared with others as it is against the law. It is important to have medical tests, such as weight measurement and mental/mood screenings, performed regularly to monitor your progress and check for any potential side effects. Make sure to consult your doctor for more details on this. If you forget to take a dose, just skip it and take the next dose at your regular time. Do not take a double dose to make up for the missed one. If you miss more than one dose, it's best to consult your doctor for further guidance. When it comes to storing Fycompa, it's important to keep the tablets at room temperature, away from light and moisture. If you're using the liquid form, store it below 86 degrees Fahrenheit 30 degrees Celsius, making sure not to freeze it. And remember to throw away any unused liquid 90 days after opening the bottle. It's also essential to keep all medications out of reach of children and pets. When it comes to getting rid of Fycompa, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.